we'll be discussing something that is very, very, I don't know about the international community, but in Africa here, diabetes is a very important issue. Okay, and diabetes have complications. In the nerves, you have a diabetic neuropathy. In the eye, you have diabetic retinopathy. So diabetes could also cause some wounds. Okay, these are the ulcers, and most of the times these ulcers occur in the lower limbs, that's the foot. So if in Africa, it's very common to see elderly people that their limbs have been amputated. Okay, this is because they have had wounds on that limb, and the wound is not healing, rather the wound is getting large and large. So they have to cut your leg just to stop that wound from getting further. Okay, so diabetic foot ulcers. So here I have a staging, I have a picture which is trying to show how the ulcers actually spread, okay, over time. Okay, so they're actually one of the most serious complications of diabetes, involving open sores or wounds that typically occur on the bottom of the foot. Okay, but they could start getting up. All right, they start at the bottom. All right, so but when diabetic foot ulcers, when they start there, they keep coming up towards your knee. So they are the major cause of infection because you don't have an open wound. So if the wound is not being treated nice, you're having infections for real. So there are open wounds on the foot of people with diabetes, usually caused by poor circulation because there's now deposition of glucose in your blood vessels, which is making the blood vessels to be tortuous or even rupturing them. So there's nerve damage and there's also pressure. So location is commonly found on the sole of the foot, on the heels and toes. Alright, but usually starts on the soles. Why? Because your whole body weight is resting on the soles of the foot. Do you understand? So issues usually start from there. So risks, about 15 to 25% of people living with diabetes usually come down with this. So causes: peripheral neuropathy, poor circulation, foot deformities, all those bunions, hamatoes, calluses, traumas, that's ill-fitting shoes, cuts or blisters. So bacteria can now easily invade due to impaired immunity. Do you understand? Sometimes it's because people having diabetes usually have a weak immune system, so infections easily set in. So symptoms is open sore or wound on the foot, swellings or redness, warmth around the ulcer. Okay, and the pus is actually draining out, and there's a foul odor. All right, sometimes there's no pain. Why? Because the nerves are already damaged. You understand? So how do we treat diabetic foot ulcer? Okay, the risks and complications: it could lead to infection because you're having an open wound. Any microorganism could just get through. It could lead to amputation. So as the wound is coming up, the only solution to that is to cut the pathway, which is cutting your leg. All right, so there's reduced quality of life, you are immobile, you are not able to do things like others, and most of those people, they actually get depressed. So high recurrence rate. So prevention is a daily foot inspection, then proper footwear, blood sugar control, because you target the root cause. What is actually causing that issue is because there's high sugar levels in the body. So if I reduce sugar levels, I reduce the issue. So wound care like cleaning, debridement, offloading, like special shoes, cast and braces to reduce the pressure, medical therapies like antibiotics for infection, and all of that. All right, so sometimes that's how you handle the issues of diabetic foot ulcers.